Dr. Muhammad Irfan. Today I am going to describe the obstetric ultrasound signs. Today I am describing the nuchal translucency scan. What is the nuchal translucency scan? It is the optional ultrasound which is performed usually in the first trimester of the pregnancy to rule out the disease like the Down syndrome, Turner syndrome. What is the nuchal translucency? Nuchal translucency is normal fluid-filled subcutaneous space identified at the back of the fetal neck, usually measured between 11 week 3 day to 13 week 6 day of the gestation. Increased nuchal translucency is related to dilated lymphatic channel. How it is performed? Fetus should be in the mid-sagittal imaging plane. Following structure should be visible as labeled in the image shown here. First of all, the skin, two parallel line, nasal bone, nasal tip, hard palate, diencephalon should be visible. At the bottom of this picture, you can see the two parallel echogenic line where the nuchal translucency is the mild. Where the nuchal translucency is the mild. What is the normal value of a nuchal translucency scan? It should be less than 3.5. Cutoff value is less than 3.5. If the value is less than 2 mm, there is risk of 1% of Down syndrome or Turner syndrome, whatever the disease, and aneuploidy. And if the value is 3.4 mm, there is risk of the 7%. 3.5 to 4.4 mm, if the value is, there is 20% risk of the developing the disease of Down syndrome. If it is more than 8.5 mm, there is a 70% risk of the developing disease. So cutoff value is usually 3.5 mm. Nuchal translucency is usually measured between 11 week 3 days to 13 week 6 days of the gestation, fetal gestation age. And CRL should be between the 45 and 84 mm. What should be? It should be, CRL should be between 45 and 84 mm. In this Zapata, you can see that a sign is shown which is called the equal sign. What is the equal sign? Equal sign is formed by the parallel orientation of the nasal bone as shown in the image. You can see the label image of the skin and nasal bone formed by the parallel orientation of the nasal bone and overlying skin on the nuchal translucency scan. What we see on the nuchal translucency scan? One is the equal sign, second is the nuchal translucency. So these two are shown in the image. If the equal sign is the absent, it means the nasal bone is absent. And if the nuchal translucency is more than 3.5 mm, these features are shown in case of the diseases like the Down syndrome and aneuploidy. So today I described the equal sign nuchal translucency, which is very important, usually measured in the first trimester of the pregnancy, usually the optional ultrasound, very well performed to rule out the disease like the Down syndrome. Thank you very much.